So good morning to all. At the outset, I would like to thank AIOC and BOS for giving me the opportunity to speak at this forum. So my topic for discussion today is longitudinal changes in pigment epithelial detachment, scarring index, a new imaging biomarker in wet AMD. I don't have any financial disclosures. So this is the spectrum of AMD which we see in our clinical setting. On the top we see that there is presence of drusenoid PED, and at the extreme end we have the presence of fibrous tissue. Somewhere in between we have presence of fibrovascular PED, which is the hallmark of neovascular AMD, in which we have presence of subretinal fluid, which we can see in the form of a cleft here, and we have a fibrovascular PED. Among all these three, the main point of differentiation is the reflectivity pattern in the OCT, which makes the clinician judge about the disease process. So the aim of the present study was to evaluate a novel automated biomarker, Pedsi, in the quantification of anti-VEGF related treatment effects and its assessment of disease activity in neovascular AMD. This was a retrospective analysis, and we included treatment naive neovascular AMD eyes which received anti-VEGF treatment and considered only patients who had PED at baseline on the OCT. So BCVA and OCT images were taken at baseline 3 months, 6, 12, 18 and 24 months. CMT and SRF area were calculated directly from the OCT images, and we used an automated image processing technique to classify the Pedsi components into three, that is the serous, neovascular and the fibrous components, and we did a longitudinal analysis of the Pedsi and other OCT biomarkers. So this is in brief how the image algorithm was used to classify the PED into three components. So just to summarize, the red component shows the serous, the blue is the neovascular one, and the green is the fibrous one. So the Pedsi was calculated based upon the ratio, that is fibrous upon the total PED area. So on results, we analyzed a total of 43 eyes. The patients received a mean of 13 injections over the period of 24 months. The BCVA showed a slight worsening over 24 months, that is there was an increase in the logMAR by 0.07. Through 24 months, what we noted that the Pedsi also showed a reduction of 0.04, which was statistically significant. Pedsi therefore showed a weak negative correlation with the BCVA in logMAR units. So these were the other parameters which were analyzed apart from CMT, subfoveal choroidal thickness. We also noted that the PED area, that is the total PED area, showed an increase over 2 years, that is it increased from 0.38 to 0.47. This graph also shows the changes in the multiple OCT parameters. The purple color line, if you can see, we see that the PED area increases. On the other hand, the Pedsi shown by the green line shows that it slightly decreased over time through 24 months. This is one of the representative images. On the OCT, if we see that there is a presence of hyporeflective area, which the algorithm picked as serous component, so it is shown as red. On the other hand, at 12 months follow-up, the BCVA with treatment improved to 20/25, and there was an increase in the Pedsi score, so the green component shows the scarring index as 0.823. These are some of the other patients in which we see that over time, in patient A, over time the vision deteriorated over 24 months. The Pedsi, however, also reduced from 0.45 to 0.17. Patient B, we see that the vision increased from 2200 to 2070. Here the Pedsi was very minimal, 0.027 to 0.087. Patient C, there was an improvement in vision. Pedsi from 0.025, it increased to 0.627 in the green component shown in the figure C. There are severe limitations with the study. We also know that there are issues with the quality and the variability of OCT images. The algorithm basically used the pixel intensities to classify the PEDs into three components. So we see that there is a significant amount of overlap between the serous and the neovascular component. So the issues what we face clinically, the algorithm also had similar issues. Then there are issues with the smaller PEDs. That quantification of the PED size becomes a challenge. PED, again, we should know that it's a ratio. So even if the total PED area increases, the PED ratio keeps on changing. And we are hoping to get a better name for this, because the Pedsi with improvement in vision, we are getting to see the improvement in Pedsi scores as well. However, as the name suggests, the scarring, the vision should deteriorate. So just to conclude, this is a longitudinal analysis of Pedsi which supports its utility as a biomarker by quantifying the amount of scarring within the PEDs, and the correlation of Pedsi with visual acuity is comparable to the other imaging biomarkers such as CMT and SFCT. Thank you.